Okay, well, thank you, everyone. Good afternoon, and welcome to Intermountain Healthcare Nevada's Medicare 101 presentation. My name is Neil Finn. I'm the Manager of Broker and Community Relations here at Intermountain Healthcare, formerly Healthcare Partners. Our team typically hosts and attends in-person events to connect with our Southern Nevada community and share the exciting things we're doing at the organization for our patients. Although we're not currently able to connect with you in person, we're thrilled to have launched virtual events to connect with you from the comfort of your own home. Now, we understand that enrolling Medicare is a very important decision, and we appreciate you joining us today to learn a bit more about your Medicare options. We're joined today by Nicole Jackson, a licensed insurance agent. And before I turn it over to Nicole, I'd like to just share a little bit about Intermountain Healthcare. Next slide, please. Thank you. Intermountain Healthcare is a well-respected regional health system and team of caregivers who serve the needs of people across the Intermountain West, with facilities from Utah to Idaho and now Southern Nevada. Additionally, we provide telehealth services and partnership agreements across a much broader area of the Western United States. Intermountain Healthcare has been recognized by national leaders as being the top 5 health systems in the country and is considered a model health system providing high-quality care and affordable cost. Both Healthcare Partners Nevada and Intermountain Healthcare align in our missions and values of helping people live the happiest lives possible to Southern Nevada. Now, if you're an existing patient, you'll still receive the same high-quality health care from the providers and care teams you've come to know at the same locations. The strengths of Healthcare Partners Nevada are combined with the expertise in the Intermountain Healthcare to create a stronger, more comprehensive regional healthcare system. Next slide, please. Now, we're currently proud of our provider network and the high-quality healthcare services we offer our Southern Nevada community. We have nearly 300 primary care providers at more than 100 primary care locations. We're excited to share more about our My Generation senior clinics on the next slide. Currently, we have 30 senior-focused clinics in Southern Nevada. Our provider network also includes access to over 1,500 specialists, 25 urgent cares and walk-in locations, in addition to 20 hospitals plus virtual visits with your care team. Next slide, please. The My Generation Senior Clinics feature concierge-style primary care design specifically for our Medicare Advantage patients. This unique concept has a lot of extra care team support plus amazing access standards to help our patients care when they need it. We have access to a dedicated referral team, on-site care management, and navigator support, plus some locations with an on-site lab. New patients can be seen within 2 weeks, while established patients will be seen within 2 days when medically necessary. We also offer same-day appointments for urgent needs. And we limit the panel size of each provider to 750 patients, so each patient can spend more time with their provider. In fact, our average appointment time is 30 minutes, which is twice as long as the industry standard. As mentioned earlier, we offer virtual visits to help our patients stay safe and healthy and at home while accessing care. Next slide, please. And here's our map of our My Generation Senior Clinics. As mentioned, we currently have 30 locations. We have over 100 senior-focused providers at these 30 locations. 5 of our clinics, which are in the green, are Humana-affiliated practices. Only Humana Medicare Advantage members can access one of those locations, but the remaining 25 accept both Humana and United Healthcare and Select Health. If you'd like to become a My Generation patient, simply call a clinic near you and we'll get your first appointment scheduled today. Now, we'll start with the presentation in a moment, but as you'll see on the bottom slide, you'll see a chat feature. If you have any questions, please go ahead and enter those questions in the chat feature, and at the end of the presentation, we will go ahead and answer those questions. So with no further ado, I will hand it over to Nicole Jackson. Nicole?
Hey, thank you so much, Neil. Thank you guys so much for being here today. I really, really appreciate it. This is just a little bit of information about myself. I've actually been a Las Vegas local now for about 32 years. I moved here when I was 12, so you can add that together and know how old I am. This is my hometown. I actually graduated from local high school. I graduated from the Las Vegas Academy of Performing and Visual Arts in 1994, which was its first opening year. In 2005, I actually started with Farmers Insurance, found out that I really don't like cars and homes. So I got into the Medicare side in 2014 and have never looked back. I absolutely love it. this is what I am meant to do. So this is what I do. I am married. My husband and I, this was actually a picture of us during the lockdown when the Strip was closed. We actually were up on the Strip riding back and forth on the street. Let me tell you, that's the one thing I really miss about the lockdown. And then the two in the corner, that's my babies, that's Chuck and that's Molly. You may see them periodically or you may hear them bark. I apologize now. Next slide, please. All right, so getting to know Medicare, go ahead and next slide. So there's always Medicare questions that are pretty standard. What is Medicare? Who is going to get Medicare? Do I need Medicare if I am working past 65? What does Medicare cover? Where can I get coverage? What does it cost? How do I choose Medicare coverage? When can I enroll? When can I change coverage? And how can you save money? Because that, to me, is probably the big one. Go ahead and next slide. All right, so first up, what is Medicare? Medicare is a federal health insurance program for U.S. citizens or legal residents. It is funded in part by the taxes you pay when you are working. So when you see on your paycheck stub where it says Medicare, that actually is going to that federal program. You've been paying into this your whole life. And it is also paid for partially so it is individual healthcare insurance, meaning that each person is an individual. So if you are married, you do not have to have the same plan as your spouse. Medicare is not free. It is not a family health plan, meaning it will not cover both you and your spouse or your children. It is not Social Security, and it is not Medicaid. Go ahead and go to the next slide. All right, so what is Medicaid? Because there is a very big difference between Medicare and Medicaid. You get, literally everybody gets these mixed up. So if you do, don't even worry about it. So Medicaid is a state government program that helps pay for healthcare costs for individuals, families, and children with low incomes or limited incomes and resources. The programs will vary by state, and the eligibility varies by state. People who are Medicare Medicaid eligible are also known as dual eligible. What that means is that they qualify for both Medicare and Medicaid at the same time. United Healthcare just brought out a program in 2021 that is specific for Medicare Medicaid. So if anybody does fall under that category, let me know and I can help you out further. Next slide. All right, so who can get Medicare? U.S. citizens, legal residents. Legal residents must have lived here in the United States for at least 5 years, and that includes the 5 years just before applying for Medicare. So if you were here for 5 years when you were 30 and then were out of the country for the next 30 years, that doesn't work. It has to be the preceding 5 years to getting Medicare. You must also meet one of the following criteria. You must be 65 and older. You can be younger than 65, but with a qualifying federal disability. Or you can be any stage of diagnosis with end-stage renal disease or ALS. Next slide. Yes, you can have both Medicare and Medicaid. Like I said, Medicare is for 65 and older and disabled. Medicaid is low income, so that's the differentiator there. And yes, you can have both. Do you need Medicare if you are planning on working past 65? That is actually kind of a tricky question. So the answer is yes. You will need Medicare post 65 regardless of who you are. Now, if you are planning on keeping your work health insurance, you can delay Medicare Part B, as in boy, which is the part that costs money. You can delay that past the age of 65 if your employer has 20 or more employees and they have credible coverage. Majority of companies, if they have 20 or more employees, it would be very strange for them not to have credible coverage. However, you will want to check with HR just to make sure. You will also need to enroll at age 65 if your employer does have less than 20 employees or it is not considered credible. Now, if you decide to keep your workplace health insurance and do not decide to enter Medicare at 65 with Medicare Part B, that is totally fine. You can keep your employer health insurance. Once you are ready to enter Medicare, you call someone like myself or you talk to Social Security and you can get enrolled in Medicare Part B. Now, what if you're enrolled in your spouse's coverage? So say your spouse works for the school district or something like that. I'm just inserting an employer here. You may be eligible to delay. You still can keep that Medicare Part A and not have Medicare Part B until you are ready to take full Medicare. I will say that about 90% of the time, give or take, the Medicare plan tends to be cheaper and better coverage for the average person. But again, that is something you will want to compare individually. Getting Medicare while you're still working, Medicare and your employer insurance does work together. If you take any part of Medicare, you will no longer be eligible to contribute to an HSA, which is a health savings account. So you will not be able to make those contributions anymore, and Medicare will not cover anyone but you. So it does not cover your children. It will not cover your spouse. It won't cover anyone but you. Right now, what does Medicare cover? Medicare cover, the basic parts of it is Part A and Part B. Part A is the hospital insurance that covers hospital and inpatient care. Part B is going to cover any kind of doctor appointments, outpatient care, testing, ambulance services, ER, emergency room, all of that stuff, all the other things. Go ahead and the next one. Okay, so hospital Part A. So hospital Part A is zero cost to you as long as you have been in the United States for a minimum of 5 years or you are a United States citizen. Part A is going to cover anything that's going on inside of your hospital room. So if you are admitted to a hospital, it will cover your room, your meals, any kind of testing, any kind of prescription drugs, laboratory services, operating, any of that type of stuff, as well as things like hospice care and skilled nursing facilities. So again, hospital Part A is going to be just hospital care as an inpatient. Go ahead, next slide. All right, hospital insurance, it is premium free if you or your spouse worked and paid taxes for 10 years or longer. You cannot be denied coverage for any reason as long as you qualify for Medicare. Coverage is nationwide and includes any qualified hospital within the United States. Coverage and costs are per benefit period. So benefit period is from January 1st to December 31st of any given year. Must be admitted as an inpatient, not observation status. One thing to keep in mind, most insurances do not like observation, so go with inpatient or emergency room. For hospital Part A, under the traditional Medicare, it provides only 60 days of reserve days. So per year, you can have 60 days, and then in reserve, you have another 60 days that is over the lifetime of your time on Medicare. Next slide. All right, so hospital Part B. This is the part that everybody, because this is the portion that actually has a cost to it. This is going to cover things like doctor visits, wellness visits, flu shots, laboratory services, x-rays, CT scans, MRIs, all of your health programs, your smoking cessation, obesity counseling programs, any of these outpatient services, anything that is done outside of that hospital is going to be covered under Medicare Part B. Next slide. All right, so Medicare Part B does have a monthly premium. That monthly premium for 2021 is going to be $148.50 per month. That is adjusted for income of incomes over $86,000 a year per person or $172,000 per year for a couple. Again, you cannot be denied coverage no matter who you are, and coverage is nationwide, including any provider who accepts Medicare, which is about 97% of doctors. Premium penalty for late enrollment unless you qualify for a special election period. We are going to go over this extensively when we get to the prescription drug side, so I'm going to leave that for them. All right, so Medicare does not cover everything. Original Medicare does not cover all of your out-of-pocket costs. There are going to be deductibles and co-payments that are on Medicare Part A and Part B, which we will go over. Your prescription drugs will not be covered. That is considered Medicare Part D, as in David, or drug. That is the portion that is federally required. You will either need to have a prescription drug plan or a Medicare Advantage plan in order to satisfy the Medicare Part D requirements. It will not include things as routine dental, vision, or hearing, eyeglasses, contacts, hearing aids, custodial care, excess charges from doctors who do not accept Medicare assignments, or care received outside of the United States. So again, that was what Medicare does not cover. Next slide, please. All right, so where can you get coverage? There's a couple of different options. Once you have your Medicare Part A and Part B, Medicare Part A, because weirdly it didn't go over this. So Medicare Part A has a deductible of $1,483. They just changed these numbers on me, per admission. So with that in mind, you have a couple of different options as far as how to do your coverage. With a Medicare supplement, which would be the lighter blue side, that's going to be a Medicare supplement or a Medigap policy. Now, Medigap policies are standardized, which we will go over those a little bit more. To pair along with that Medigap policy, you will also have to have a Medicare Part D prescription drug plan. Those will vary in cost and vary to who they will apply, just because of the fact that everybody has different medicine needs. So again, those are going to be per person. The other option would be to go with a Medicare Advantage plan. Now, the Medicare Advantage plan, they usually are a little bit more cost effective. They don't usually have a high monthly premium. They are also called Part C. Those plans will include your prescription drug plans and also offer additional benefits like vision and dental coverage. Next slide. All right, so Part C, as I told you, those are going to be the Medicare Advantage plan. So this is a way to have a more set plan, kind of what you're used to more now with regular traditional insurance. Instead of having just, okay, your deductible for this is $1,475. For Medicare Part B, it's $203 plus 20% of all charges. Instead, you're going to have a list of what your costs are going to be. This is an alternative to the regular traditional Medicare Part A and Part B. Plan members are still enrolled in Medicare. That does not ever disappear. That is not something that happens. You are still in Medicare with a Medicare Advantage plan. However, it will be administered by an insurance company, and for doing that, there may be a doctor network involved, and there may be co-pays for different plans. I will say that with my knowledge of Medicare Advantage plans, if you haven't been on one yet, you would be very pleasantly surprised with the co-pays and the amounts on all of them. There are some really fantastic plans here in Las Vegas. Those plans will offer additional benefits such as dental, vision, and fitness, as well as, you know, other options like over-the-counter drugs and things like that. Next slide. All right, so Medicare Advantage plans cover all of the benefits of Part A and all of the benefits of Part B. They are not allowed by the federal government to cover anything less. They have to cover that or more, period. Most of Medicare Advantage plans are going to cover prescription drugs. There are currently a couple plans in Las Vegas that do not, so make sure you look at that. Medicare Advantage plans can also include additional benefits, like I was saying, of dental cleaning, dental cleanings, exams, x-rays, dental work, hearing tests, hearing aids, wellness programs, all sorts of stuff. Next slide. All right, so with a coordinated plan, there are a couple different types of Medicare Advantage plans. You have your normal ones, which are the HMO, the PPO, the point of service POS, or a special needs plan. You also have the PFFS, which is a private fee-for-service plan, or a Medicare savings account. Here in Las Vegas in Clark County, the types of plans we currently have are going to be the HMO, the PPO for the preferred provider organizations, the dual special needs program that is specific to Medicare and Medicaid, and the chronic special needs program. Next slide. So fast facts about Medicare Advantage plans. You must be enrolled in Medicare Part A and Part B and live within the service area in order to have it. You cannot be denied coverage because of current financial, health status, including pre-existing conditions. So there is no, it doesn't matter what's going on with you medically, you cannot be denied coverage. May be required to use a certain provider network or pharmacy network. That is a possibility. Coverage and costs may vary by plan, and they can actually change per year. My experience with the Medicare Advantage plan world is they change little bits every year. They're usually very minor changes. Annual limits on your out-of-pocket coverage. With traditional Medicare, you don't have a limit. It can be as much as it's going to be. With Medicare Advantage plans, you will have the knowledge that it would be this amount max. You cannot exceed that per year ever, which is kind of a nice feeling to have. May charge a monthly plan premium, and you must continue paying your Medicare Part B premium. I would say probably 90% of the Medicare Advantage plans here in Clark County have a $0 premium. However, there are a few that do have premiums, and on top of that, you will have to continue paying that Medicare Part B premium, which again is that $148.50 per month. Medicare prescription drug coverage. Now, this is going to be a standalone plan, which is a little different than the Medicare Advantage plan because it can be included in there. With the Medicare Advantage or Medicare prescription drug plans, go ahead and go to the next slide. So Medicare Part D covers types of drugs that are most commonly prescribed for Medicare beneficiaries that are determined by federal standards. They can also include special brand name drugs, generic drugs that would depend on the insurance company that would decide on those, and the commercially available vaccines that are not covered by Part B. So the commercially available, that's going to be like the shingles vaccine and things like that. That would be covered under Medicare Part D as in drugs. Next slide. All right, so with a Medicare prescription drug plan, and this is going to be for both the standalone as well as the Medicare Advantage plan, they're always going to come in a tiered formulary, which is, first tier is going to be the least expensive, the highest tier is going to be the most expensive. So that's kind of how that works. Now, tier one is the really cheapest. Those ones are going to be those really preferred generic drugs. That's probably about 50 to 60% of drugs I see, honestly. The lower the tier, obviously, the lower the drug, the lower the cost. So, next slide. All right, so during the year, you may go through different stages of the drug coverage stage. This is probably the most confusing piece of Medicare, and I truly apologize because this is not the fun slide. So how this works is you have your annual deductible of whatever that is. I believe for 2021, the max annual deductible is $475. So once you pay your initial deductible, if there is one, the plan will tell you if it exists. Then you move to the initial coverage stage. That initial coverage stage is going to be what is printed in your book. Once you get to $4,130 of both what you pay as well as United Healthcare, then you go into what is called the coverage gap or the donut hole. The donut hole is, So once you get over that amount, you fall into the donut hole. At that point, you're going to pay 25% of the cost of your drugs until you reach the $6,550 of your out-of-pocket costs at this point. So the first number, that $4,130, is both what you pay and United Healthcare together. The coverage gap, that $6,550, is what you pay, not anybody, just you. So once you get over that number, then you would fall into the catastrophic stage. At the catastrophic stage, you would have a very small copay of like $3.60, I think it is, for generic, and $9 and something cents for the brand name prescription drugs. Again, this is the most confusing portion of Medicare. If you would like to have a private consultation where I can go over your drugs with you, please let me know. I'd be happy to do so. There are ways to check and make sure that you are on the right plan for your prescription drugs. Next slide, please. All right, so again, fast facts with prescription drug coverage. You must be enrolled in Medicare Part A and Part B. So you do have to have both. May be required to use a pharmacy network. That would depend on the plan. The coverage cost may vary by plan because they do change every year and they can increase or decrease costs. You always want to check that. And Medicare Part D premium late enrollment penalty unless you qualify for a special enrollment period. So how this works, this is called an LEP, late enrollment penalty. If once you enroll in Medicare Part B, let's say that you started Medicare on 2/1/2021 with Medicare Part A and Part B. I just turned 65, but I don't get Medicare Part D until open enrollment, which is October 15th to December 7th, and it's not going to start until January. So what happens is after I've been enrolled in Medicare Part B for 3 months with Medicare Part B, and I do not have prescription drug coverage, I will get a fine of 1% per month for every month I do not have Medicare prescription drug plan. Now, how much is it per month? Well, that varies depending on what the average cost of the average prescription drug plan is. Right now, my estimate is probably around $30 because that makes it a little easier for me to calculate in my head. So $30 a month, I'm looking at, let's see, so February, so about 6 months of having a late enrollment penalty. That would put me at about $1.80 per year or per month for the rest of my life. That is one stipulation with that Medicare Part D late enrollment penalty. It is for the rest of your life. Please keep that in mind. It is important. Next slide. All right, so Medigap and supplemental insurance, this is the other version. This is the one that you're actually going to pay for. Now, what is the difference between a Medigap policy and a Medicare Advantage policy? A Medicare Advantage policy is going to have a lower premium, going to have a doctor network, and it might be an HMO or something like that. A Medigap policy is federally regulated. They do not vary. They are exactly the same. If you have a Plan F, you have a Plan F, you have a Plan F. There is no variance per state. So every Plan F is going to look identical. With a Medicare supplement, you can go to any medical doctor you wish that accepts Medicare. The drawback with a Medicare supplement plan is the fact that it is going to have a monthly cost. Monthly cost to start in 2021 as a 65-year-old person is somewhere around $150 a month for Medicare Plan G, as in George. So with a Medicare supplement, it does work with your Medicare Part A and Part B. You cannot use a Medicare Advantage plan in addition. You can't have both at the same time. Again, they are federally standardized. They are going to have letters, so it's going to add to your alphabet soup. Apologize for that. Plans with the same letter offer the same benefits nationwide. So again, a Plan F is a Plan F is a Plan F. And plans are offered by private insurers. Next slide. All right, so with the Medigap policy, plans may pay your hospital Part A coinsurance, your hospital Part A skilled nursing facility coinsurance, your hospital Part D coinsurance or copays, cost of blood transfusions, extra days in hospitals, the deductibles, things like that, as well as foreign travel. Next slide. All right, so as you can see, this is actually a list of the Medicare and Medicare supplement plans. Like I said, they are federally standardized, so there is no variation. Now, in Las Vegas, you have two plans that are the big plans that are available. That's going to be Plan G is in George and Plan N is in Nancy. The rest of the plans are actually not offered in Clark County, and unless you were a Medicare recipient before 1/1/2020, Plan C and Plan F are not options for you. Plan G, honestly, is the most popular of the Medicare supplement plans. With Medicare Plan G, you are going to pay Your Medicare Plan B deductible, which is the $203 per year, everything else is going to be covered at 100% except for in travel, which is covered at 80%. So that's kind of that's a really nice plan, but again, it does cost you money. So that's what the difference is between those Medicare Advantage and Medicare Supplement. Next slide. By the way, I do not recommend Plan N. It is actually cheaper than Plan G. However, if you look on there, there's a lot more things that you end up paying for. So I don't honestly recommend that one. All right, Medigap policies. You must be enrolled in Medicare Part A and Part B, just like you are with every other plan, and you must live in the state where it is offered. There is no medical underwriting for up to 6 months after your 65th birthday or after enrolling in Medicare Part B. There is a national coverage and no provider network. So people like to call it a PPO. It's not a PPO. There is no provider network. You can go to any medical doctor who accepts Medicare nationwide. Guaranteed renewable as long as you pay your premium. So as long as you pay your premium, it never goes away. Plan premiums may vary for the same coverage. You may also get plans with more coverage generally obviously have higher premiums, and you must continue to pay Part B in order to get Medicare. So you have to have Medicare Part A, Part B to be on any of these plans. Next. So how much does Medicare cost? We were already talking about that a little bit. The premium is going to be $148.50 per month. That is going to be coming out of your Social Security check, or you will be paying that quarterly. Excuse me. You'll be paying that quarterly if you are not taking Social Security yet. If you are making more money and would like to know what the Medicare Part B premium is, please catch my phone number or my email address at the end of the presentation, and I would be more than happy to answer that for you. You can also find that information on Medicare.gov, just so you know. Deductible is going to be the amount that you pay for coverage before your plan begins. The deductible for Medicare, traditional Medicare, is going to be that $203 per year for Medicare Part B and $1,470 per admission for Medicare Part A. Copay is going to be the fixed amount of any time that you receive services. So if they say it's a 0 copay or a 25 copay, that's what that means. It's a fixed amount that you pay for that service. Coinsurance is going to be that percentage. So whenever you see a percentage, like an 80-20 or a 90-10, that's where that term coinsurance comes in. Next slide. Part C, Part D, and Medigap costs. So Medicare Advantage plans, they typically have very low premiums. They can be as low as $0 per month. They may or may not have a deductible. They may or may not have high copays. Excuse me. They usually have very low copays, and they will have very small coinsurance amounts. The prescription drug plans, your cost could be monthly premium, deductible, copay, and coinsurance, depending on what you are looking at. Medicare supplement insurance, Medigap policies, you're going to be paying your monthly premium. That's the one that is going to be, got to pay the monthly premium. It'll have a deductible, and then it will have copays. The Medicare Advantage plans have a max out of pocket, which is unusual for any of the other plans. It's one of those things that when you look at the plan, if it says max out of pocket, that is the most amount of money that you can spend in a single year from January 1st to January 1st. I am losing it today. January 1st until December 31st each year. Perfect. Next slide, please. So how are you going to choose what kind of plan you want to be in once you turn 65 or once you join Medicare? Well, that's, go ahead and go to the next slide. I don't know if that's, okay, so it does actually give me some combinations here. So you do have some choices. The first choice up here that says just Medicare Part A, Part B, that's not a valid choice. You're going to get a late enrollment penalty, so don't do that. Medicare Part A, Part B plus prescription drugs is on the next line. That is an option. You can absolutely do traditional Medicare plus a prescription drug plan. The next one is Medicare Part A, Part B, plus a Medigap plan. Again, that's going to end up being a problem because you don't have prescription drug plans, so that's not valid. The next one, the bottom one, the fourth one, Part A, Part B, plus prescription drugs, plus Medigap. 100%, that's a great way to go. The other option would be to go with Part C, which is a Medicare Advantage plan that includes your prescription drug plans if you need them. So it just kind of depends on which direction you want to go. Sitting down with someone like myself who can go over your personal situation, because everybody's situation is different. So sitting down with someone like myself to discuss your personal situation would be the best option. So this is just a slide showing us the different Medicare options and stuff. You definitely have to go with that first step of enrolling in traditional Medicare. And then after that, we can work on looking at the Medigap policies versus the Medicare Advantage plans, depending on what you need. Next slide. All right, so this one is just a little information about what to expect versus Medigap versus Medicare Advantage. So the big difference between Medigap and Medicare Advantage, Medigap is going to cover medical only. It covers what Medicare covers, only what Medicare covers, and nothing further. So it covers medical only. There will be a premium, a monthly plan premium, and you will need to get a prescription drug plan to go along with it that will also have a monthly premium. Who do I personally put into a Medigap plan versus a Medicare Advantage plan? A Medigap plan is going to go to the person who just wants it. That's what they want. That's what they're going to get. I'm not going to argue. That's what you want. I'm also going to definitely encourage somebody to go with a Medigap plan who is currently undergoing treatments where having to get an authorization or something like that from the insurance would be detrimental to that person's health. So again, these are going to be questions and things that are going to be answered individually, and they're going to be things that you will want to talk to an agent like myself about. With a Medicare Advantage plan, in contrast, yes, it covers everything that Medicare covers, but it also covers over and above. Majority of Medicare Advantage plans are not only going to offer medical, but they're also going to offer prescription drug plans, as well as dental, vision, hearing, your gym membership, over-the-counter benefits, and several other things. Next slide. So when can you enroll? If you are turning 65, it's going to be the 3 months before and the 3 months after. So you actually have 7 months to get yourself enrolled and on Medicare. I do recommend doing it for your birthday because that's usually the better time to do it. So starting at 3 months before your birthday and having it start on your birth month is definitely the best idea, but it's not the only way to do it. Next slide. All right, so the general enrollment period, there are a couple of different ones. This is going to be for those who missed their initial enrollment. Oh, excuse me, this is actually a little bit different. This is your general enrollment period for those people who did not enroll in Medicare at all. Like you didn't have insurance, you didn't get insurance, and you didn't enroll for Medicare. From January 1st to June 31st, you can actually sign up for Medicare Part A and Part B. And excuse me, that is actually March 31st. I was looking at that incorrectly. So January 1st to March 31st, you are able to enroll in Medicare Part A and Part B, even if you did not have credible coverage. There may be late enrollment penalties that apply. That is for Social Security directly. Medicare Parts B and C and D prescription drug plans, you may choose to enroll in that period of time if you missed your initial enrollment period. Now, the Medicare Supplement open enrollment period, like they said, it is the first 6 months after your 65th birthday or after getting enrolled in Medicare Part A and Part B. So it's just the first 6 months. Next slide. Special enrollment period where you're working past 65. So you do get, for those who delayed enrollment with credible employer health care, you have 8 months to enroll in Medicare Part A and Part B, or both. So you must get that done quickly. So you have 8 months to enroll in Part A, Part B. you'll only have 2 months to enroll in a Medicare Advantage plan, Part C, or prescription drug plan. So after you get enrolled, you only have 2 months to get that taken care of. You have exactly 63 days to get a standalone prescription drug plan. So that would be that 2-month window to get that Medicare Part C and D. Otherwise, you will get a fine. Medicare Part A doesn't cost you anything. So this is the late enrollment premiums, just so you know. Medicare Part A, there will be none as long as you are qualified. So as long as you qualify for free premium, you are totally fine. The penalty is 10% of the Part A premium if you did not have credible coverage. So for Medicare Part B, there is none if qualified for a special enrollment period. So if you had credible coverage, there will be no late enrollment period or late enrollment fee. The penalty will be 10% if you were not enrolled in Medicare Part B and you did not have any kind of coverage, did not have credible coverage. And then we already kind of went over the prescription drug portion with Medicare Part D. That's the part where you do the 1% of average. So, yeah. Next slide. When can you change your coverage? We have our Medicare open enrollment every year. This is when you see all the crazy commercials and all of a sudden your mailbox just gets flooded with stuff. So that's going to be from October 15th to December 7th of every single year. At this point, you can change from a Medicare Advantage over to a Medicare Supplement with a prescription drug plan, or you can change from a Medicare Supplement with a prescription drug plan over to a Medicare Advantage or to a different Medicare Advantage. You can do this as many times as you like during this period of time. Whatever is left standing on December 7th is the plan you will be enrolled with for the year following. Medicare Advantage open enrollment. So this is something they just put in about 3 years ago. From January 1st to March 31st of any given year, if you are enrolled in a Medicare Advantage plan, you can choose to change to a different Medicare Advantage plan during that period of time, but you can only do so once. All right, and then special enrollment period, and this is for qualifying life events, for moving, leaving, like leaving a retiree of a union or a COBRA coverage or anything like that. So if you are losing employer group healthcare or moving in or out of a state or a city and you're changing plans, you have 63 days, 2 months to get that taken care of. Next slide. All right, last but not least, how can you save money? You're going to use your benefits wisely. Medicare has a lot of options. Medicare Advantage plans have some great stuff in there, so you definitely want to know what your plans have. Use your preventative services. Get your vaccines. Get your prescription drugs like you're supposed to. Use the over-the-counter benefit. You know, most of the plans have an over-the-counter program. You can get your Advil, your Tylenol, your cold meds, your allergy meds, all sorts of different stuff from these over-the-counters. Get your stuff. Use it. Use your plan's provider network. That's always going to save you money. Ask your doctor about generic or low-tier prescription drugs. And then use the preferred pharmacy. If that plan has a preferred pharmacy, use it. It will save you money. And understand what your hospital status is. Again, Medicare really hates observation. So you're either in the ER or you're not, or you're admitted, because that observation status can actually cause you some issues in the future. Next. So this page right here, this one just gives you some financial assistance programs. If you happen to need it, this will have some phone numbers and things on it for you. The Extra Help and Medicaid, that is going to be through the state. If anybody would like the phone number or anything, let me know. And then the Medicare Savings Account programs, where you can help pay Medicare Part A and Part B, that's also going to be through Medicaid, and that will be per your income. And then, of course, there's also programs that are all-inclusive care for elderly. Those are called the PACE options. Provides care for service for frail elderly living in the community. So it's a better program for those who are a little bit older and needing a little bit more service. Next. All right, so where can I go for help? some more information for you guys. Medicare Made Clear is fantastic. The other one that I would recommend would be Medicare.gov, just GOV. That actually has a ton of information for you. Next. Oh, and speaking of which, there's what I recommended. You can also call 1-800-Medicare, and if you do need your local Social Security's phone number, let me know, and I can get that for you as well. This is my contact information, guys. If anybody wants to write it down. Neil, are you going to tell me the questions, or because I can't see them in the chat?
Yeah, thank you, Nicole. Fantastic presentation, great information. Yeah, I do have a quick couple questions here. Once again, a reminder, you can go ahead and type in your questions in the chat feature, and we'll go ahead and answer those now. I have a question about Medicare coverage combination. If I'm looking to have my eyes examined and a dental cleaning, Medicare A and B only is enrollment won't cover my eyes and dental. I would have to get Part C or D. It'll cover both eyes and dental.
Okay, so the only plans that are going to cover eyes and dental for vision coverage for like glasses or for any kind of dental is going to be Medicare Advantage plans. That will not be available on any prescription drug plan or Medigap policy.
Okay, perfect. And in addition to that, it says it's free and there's no deduction whatsoever. Now, if that's true, a lot of calls. Would any company be able to operate without any income? Does company get share of expenses from Medicare to cover those expenses?
So this is in regards to how it would work with a commercial policy?
I believe so, yes.
Okay, so if you're going to stay on your commercial policy on a healthcare policy through your employer, what I would recommend, as long as they are credible coverage and over 20 employees, I would actually recommend just taking Medicare Part A. Medicare Part A will help supplement the hospital side of your current plan through your work, but it will not give you any of the extra benefits. And that will be free for Medicare Part A. Medicare Part B is the only one with the premium.
Wonderful. Thank you, Nicole. And I'm not seeing any additional questions. Lisa, do you have any additional questions you see there? Okay, I do have one other question. I do have some other questions here as well. I live 6 months in Nevada and 6 months in Washington. Will a supplement plan be better for me over the Advantage plan?
Okay, kind of both. So for you particular, 6 months in here, 6 months in Washington, you've got kind of two different options that you can actually do. One would be to go with the Medicare supplement because that can travel with you no matter what, no problem. The other option is United Healthcare in 2021 did come out with a plan that would be a PPO. Humana has an option as well, so there are a couple different ones to choose from. If you have a PPO, like the one with United Healthcare, we would give you a national network that would allow you to see doctors in Washington as well as down here in Clark County in Nevada. Now, if you have the HMO version of a Medicare Advantage plan, keep in mind that you would still have access to emergency room, urgent care, as well as all emergency services, ambulances and everything like that. You just wouldn't be able to go for your cardiologist follow-up. You would do that down here in Las Vegas. So you do have some options. You just got to choose what's best for you.
Gotcha. I know maybe some folks, if they have difficulty seeing the slide, we went ahead and put Nicole's email address in the chat feature, so that's easier for you to view there as well. It's njackson@helpyousaveinsurance.com. I know you just addressed this, Nicole, but I'm going to read the question. Just can I combine this with an Advantage plan, or is it technically a Medicare supplement plan?
Okay, so she actually, she had started on this other line. She says, I have Medicare Part A and Part B plus a retirement program that covers Medicare Part D. some copays and deductibles. Can I combine this with a Medicare Advantage plan? Unfortunately, the answer is no. And is it technically a Medicare supplement program? Honestly, I would have to take a look at what exactly you have to give you that judgment. If you contact me directly, I would love to talk to you and just see what you have and make sure you're on the right track.
Wonderful. Perfect. Thank you, Nicole.